The state announced 17,000 new infections and 280 additional deaths over a 2-day period. That's an average of about 8,500 new cases a day. This is our highest case count in nearly a year. Now, the surge in cases prompting the state to ask the U.S. Defense Department for emergency assistance. The feds are sending in medical support staff, 2 teams of 22 nurses, respiratory therapists, and doctors, but only to 2 Michigan hospitals, Beaumont in Dearborn and Spectrum Health in Grand Rapids. The John Dingell VA Hospital in Dearborn will be used to help overflow patients. There's still a shortfall of staffing. 7 Action News reporter Jim Kurtzner talked with the Michigan Director of Health to get answers, and he has more from Beaumont in Dearborn.
Michigan Health Secretary and the state of Michigan have a lot of work to do. We learned that the urgent request for medical staffing came from the Michigan Health and Hospital Association last week, an important voice for all hospitals.
In our letter to the governor, which we sent late last week, we asked for a total of 150 in the state, but we are totally dependent on the federal government for what they decide to send to Michigan.
22 nurses, respiratory therapists, and doctors coming here to Beaumont in Dearborn within a week. A similar team going to Spectrum Health in Grand Rapids. They'll be here at least 30 days. Why these 2 hospitals when the needs are statewide?
We work with the federal government to do an evaluation based on their capacity, the number of cases that they have, and staffing. And then based on that, the federal government makes a determination on where their resources are best utilized.
The surge in COVID cases, staffing shortages, just part of the story.
Not only do we have in some areas, a record number of people admitted to the hospital with COVID-19, we also have very high levels of people with high acuity diseases, whether it's types of heart disease or cancers or whatever else it might be.
This is not the first time the feds have sent in medical support during the pandemic. What other options does Michigan have to cover staffing shortages?
At this point, there isn't much else that we can do to provide support to these hospitals. What they are able to do is work amongst themselves. We can coordinate with other states if necessary.
The state is still providing only guidance. Get vaccinated, wear masks in public, no restrictions on public gatherings, no lockdowns, no mandates. Are those gone for good?
I don't think we can take anything off the table ever.
Congresswoman Debbie Dingell from here in Dearborn, along with Congressman Fred Upton, have requested from the Biden administration staffing as well as medical supplies. Secretary Hertel says the most needed item, COVID testing. In Dearborn, Jim Kurtzner, 7 Action News.